Which of the arterial gas analysis shown below would most likely seen a patient with the pulmonary embolus? So in pulmonary embolus, what type of the metabolic abnormalities or ABG changes occurs? Here the discussion, a combination of hypoxia and respiratory alkalosis should suggest of the pulmonary embolism. Respiratory alkalosis is due to hyperventilation associated with the pulmonary embolism. That means the pulmonary embolism, it is responsible for the respiratory alkalosis. So respiratory alkalosis occurs in case of the pulmonary embolism. So first of all, let's see the pulmonary embolism or respiratory alkalosis. Here this is the respiratory alkalosis equation. In respiratory alkalosis, it is alkalosis, that means the pH is increased. In respiratory phase or in respiratory acidosis or alkalosis, in this condition the pH and other parameter, they relation inverse. That means when pH increase, the bicarbonate reduce and partial pressure of carbon dioxide reduce. And as it is the respiratory, so the first parameter is the partial pressure of the carbon dioxide. So when there is the respiratory alkalosis, first of all what reduce? First of all reduces partial pressure of carbon dioxide. Then for compensation, bicarbonate level also reduce. So in respiratory alkalosis, first of all pH which will increase, then as it is the respiratory factor involvement, so in this condition partial pressure of carbon dioxide will reduce. And this is the compensatory or not compensated. In this condition bicarbonate level will be normal or bicarbonate level will reduce slightly. So it will be our answer. So now see the different type of pH in this equation. So what is pulmonary embolism? In case of pulmonary embolism, it develops the respiratory alkalosis. So in respiratory alkalosis, that means the pH will be increased, and we know the normal pH is 7.35 to 7.45, and when there is alkalosis, when the pH is more than 7.45. So let's see the pH which is more than 7.45. So the first option, it may be the answer. pH 7.25 which is less, 7.2 less, 7.6 it may another answer, and the 7.50 may be the another answer. So what will happen next? Then partial pressure of carbon dioxide, it will decrease. Partial of carbon dioxide, it will be decreased. The normal level of partial pressure of carbon dioxide, it is 4.5 to 6 kilopascal. So the partial pressure of carbon dioxide will be less than 4.5. So now we have to search the partial pressure of carbon dioxide in the definitive equation. So in here the partial pressure of carbon dioxide 2.8 kilopascal. So it may be a option. In case of here partial pressure of carbon dioxide 5.8, which is normal, it is not true, because the partial pressure of carbon dioxide will be less. And in case of last option, the partial pressure of carbon dioxide 2.5, which is the less than 4.5, so it may be the another option. Now we have to see the bicarbonate level. The normal level of bicarbonate level, it is 22 to 28, and in this condition this bicarbonate level is normal because it is not compensatory. When compensatory, then bicarbonate level also reduce. So in this condition the bicarbonate level will be normal. So let's see the normal bicarbonate level or slightly reduced bicarbonate level. So here the bicarbonate level is 20, which is reduced because the normal range 22 to 28, and in the last option the bicarbonate level is 24, which is the normal limit. So our answer will be this last option. So here we can see this is the last option. Another important phenomenon we can remember that in case of the respiratory case, partial pressure of oxygen will change and it will be reduced, and in this option here we can see the partial pressure of oxygen is 7.2, which is less than 11 to 14. That means normal partial pressure of oxygen is 11 to 14. The lungs is directly deals the oxygen, so when the oxygen concentration is reduced, then it will be the respiratory cause. But in case of first option here, the partial pressure of oxygen which is 10, which is very close to normal, so it will not be option. So here in pulmonary embolism, first of all the pH it will increase, partial pressure of carbon dioxide it will increase, bicarbonate it is normal, and partial pressure of oxygen it will reduce in case of respiratory case.